Good morning everyone and happy Tuesday. Today I want to do a quick video about community health because this week is Community Health Week, and obviously with everything that's been going on since March, community health has been more important than ever, but definition of it varies by country and city. So I wanted to touch on that and talk about a couple of the different aspects of it. So in our area here in Southern Ontario, it means the health status of a community and to the organized responsibilities of public health, school health, transportation safety, and other tax-supported functions. So public health is pretty straightforward. We've been going through that for a long time. That's the whole onus behind vaccines and social distancing and all of that. School health is obviously the health of the staff and faculty and students that are at the schools. So trying to put protocols in place to keep the kids safe and to make sure they don't bring anything home to their parents. Transportation safety. Up here we don't have buses in our town because it's not big enough. However, some of the buses from the city come up and loop around here and then head back down. We also have the GO train and the GO bus. So we do have a lot of transportation options, and making sure that people, social distance on buses and sanitize everything and wear masks. That's just really all they can do other than shutting down public transportation, which would grind our world to a halt. Tax-supported functions is very vague, but I know in some areas this meant closing playgrounds to make sure that kids weren't, touching handrails and touching their face and then getting it that way, and making sure there's no outside events, no outdoor events. I think right now it's no bigger than 10 people, but for a long time there was no outdoor events at all. In the summer here, we usually have a Canada Day type festival. We usually do some outdoor concerts and stuff like that. We usually do movie nights outdoors, and we usually have some food festivals later in the summer, which obviously none of those happened, but they're all elements of community health, and many of the staff in these areas have been working extra hard since March, so I just wanted to acknowledge that because they're kind of usually the ones that get left out when it comes to frontline workers, because they may not be in direct contact with it, but they're the ones that are building the protocols to try to keep us safe. So in terms of community health, there's one more thing I want to talk about, and I have done a video on workplace health too, if you haven't seen that one, and that talks more about making sure you're in a good environment and there's, respect and kind people and it's clean and that kind of stuff. But herd immunity has been a hot topic since March, and the idea of vaccines. So herd immunity is a form of indirect protection from infectious disease that occurs when a sufficient percentage of the population has become immune to an infection, whether through vaccination or previous infections, thereby reducing the likelihood of infection for individuals who lack immunity. So I read something recently, and I always mix these two up, but a country in Europe, it was either Sweden or Norway or the Netherlands, can't remember which one, they actually did studies to prove that herd immunity was more effective than social distancing. However, there's always a stipulation, right? However, their elderly were hit much harder than ours were, but their overall numbers were lower. So herd immunity isn't a perfect answer, but it can sway the numbers one way or the other. And because the immune compromised can't or either take longer to develop herd immunity, or they struggle to build it in the first place, keeping our working class, which is usually about 20 to 50, that age range, keeping them safe and healthy and allowing the herd immunity to build in them they can then pass that to their kids if they have kids. But a lot of those people were still going to visit, you know, their relatives in old age homes and retirement homes and passing it to them. However, if they were carrying the virus and they had the non-symptomatic kind and they had herd immunity, they wouldn't know that they had it and then therefore pass it to their older relatives. So something to think about, because there's always more than one side to the story and there's always more than one way to do things. And I know people have been debating about masks, no masks, vaccines and no vaccines, and I do think that protecting the public should be important, but I also, because I'm the type of person that believes in holistic modalities in conjunction with traditional medicine, that there is definitely more than one way to do this. And we've been very lucky here in my immediate family because we all have fairly good immune systems. And yes, the allergies are really bad right now for a lot of us, but all things considered, we haven't gotten anything. We haven't been around sick people. So I'm very, very grateful for that. And if you can, or are in a situation where you can do that as well, that is very, very good for you. Try to keep it that way. However, I know with back to school, a lot of us don't have that choice. And those of you that chose to keep your kids home and homeschool them instead are exercising that choice and learning a whole new aspect of community health. And that's really one of the main tenets of making that decision, because you have to decide whether you want to risk putting your kid with all these other kids, because then the responsibility of their health falls on all these other kids and their parents too. So it's a big, multifaceted topic, and this is kind of just a brief introduction. But I hope that you'll do a little more research into it and that you learned something interesting today. But I hope you have a fabulous rest of your day, and I will see you later this week for a video on Instagram for International Spine Day. Very fun. I'll see you later this week.